Okay, so 683 days have passed since I got Post SSRI Syndrome, or the more popular term PSSD, and my symptoms have been exactly the same. I have done new studies. I have made a skin biopsy to test for small fiber neuropathy. I have consulted with many new doctors. So this is going to be a video just giving an update. So I had a skin biopsy in a hospital in Mexico, in the state of Nuevo León. It was a skin biopsy in the ankle. They took a small part of skin, and then using chemicals they analyzed and counted the nerve fiber density, and apparently it came negative, but as far as I know, it depends a lot on where you do the test. Maybe if I do the test in another part of the body, I can be positive. So with the test I had, I came negative. So when it comes to my symptoms, I have been exactly the same, no improvement. I have been in all this time I have had different stages in where I'm trying to adapt to this new body, and what do I mean by that is that my emotions are numb and my body is numb. Like I lost sensibility, not completely but significantly, and I mean it's hard to live like this because everything changes. It's not the same. It's hard to explain. It's a very abnormal state, conscious state, and also another symptom I have is that I can't visualize a lot in my head or imagine things. So also it's hard to take these decisions this way. Like for example, right now that I'm talking, I can't imagine what I'm going to say next. I just say it. So it's been hard to get used to this. Instead of thinking what I'm going to do, instead of having a plan in my mind and knowing exactly what I'm going to do, now I have to direct myself with emotions. I have to follow my emotions, and that's because my idea, my hypothesis is that maybe there's some very small nerves involved in imagining things. Maybe they are disabled, and my unconscious probably knows what I need to do exactly, but me consciously I don't know. I just follow my emotions. It's like a compass. They just tell me what I need to do, and they kind of know what I should do. So getting used to this has taken a long time. So since this started happening, I had different stages. I had some stages where I thought everything's over. Then I started realizing that until to a certain extent I can live a kind of normal life. When I started like realizing what's going on, I would the condition as a whole, Post SSRI Syndrome or PSSD, I would simplify it as nerves, disabled nerves, like nerves not working as they used to. And it makes sense, like all the range of symptoms associated with this condition, they fit this category. I will call it a neuropathy, a type of neuropathy. I mean, everything makes sense for me. All the symptoms fit into a neuropathy category. Even making this type of videos is hard. It's hard because I can't really plan ahead what I'm going to say, and also I really don't have motivation to make a script. So yeah, it's hard. Also, I used to speak very fluently, and right now, apart from English not being my first language, I also talk like this in Spanish, like with pauses, and I didn't used to talk like this. I used to, well, I have always liked rap, like the music genre. So yeah, I have always liked rap, the music genre. I don't know if that's how you pronounce it, and I can't do it now because I can't think ahead what I'm going to say. So all this time I have learned many things. I have talked to many people, and I'm at a point where I haven't met any doctors that deny this condition, and I think it's very important the way how you explain it to the doctor, because if you come to the doctor and tell them I took this medication or I stopped the medication and I'm having a lot of symptoms, and there's a lot of people online that have the same symptoms, and I'm losing my mind, it's horrible, it's like hell, it's horrible. I mean, the doctor, you need to be very, you need to be intelligent when talking, explaining things to the doctor, because I mean, the doctor is trained until a certain point to know when the patient is exaggerating things. So that's one point, and the other point is that there's not much medical literature about this condition, and it's not recognized still in a mainstream way. So the way I have speak to the doctors is that I tell them I had a adverse reaction to this drug. I took it. This happened. I tell them that I know how the drug works. I know that it takes several weeks for it to work. I tell them that I know the half-life of the drug. I tell them that I know which is the minimum therapeutic dose. So when I start explaining everything with giving context, they realize that I know what I'm talking about. And I also tell them I have consulted many doctors. Some of them are from other countries, and they have some have prescribed me some things. Some have I never told them no, this doctor didn't believe me. Instead of telling them this doctor didn't believe me, I tell them that doctor didn't know much about his area, because they really I mean, I have to this point I have researched a lot, have talked to many people, that I kind of know when doctors really are expert in their areas. So yeah, so I just told them like I went to this doctor and I realized he didn't know much about it, about the topic, and I just told them like concrete examples, like for example, and this is true, the second psychiatrist I went after I got this condition, I was explaining to him that like this wasn't normal. I took this drug before. I only took some small doses, and he was like, he told me, this shouldn't happen to you. It's impossible. I'm a professor in a university, and I know that this couldn't happen. And he told me, your problem, what you have, is a condition called doubt. Like that. He just told me like that. Like, you have doubt. You suffer of doubt. Of I'm going to put the word here. And I told him like, okay, what can I do about it? And he told me, okay, you can contact this. I have a friend, another psychiatrist friend that could help you. And I say, okay, well, okay. So I try to make an appointment with the other new psychiatrist, which is supposedly an expert in doubt. And well, I never consulted with a new doctor because it was the most expensive psychiatrist I have seen in my city, in my state, which is Nuevo León, Mexico. And yeah, it was kind of crazy. Yeah, what he told me, like I think many times some doctors just make up things. I have seen that many times doctors make up things, and mainly I think because they want to be seen as experts. I mean, they are selling. They want money at the end of the day. But there's ethical doctors, and there's some that just want money, and they want to be seen as experts. So they want to, and they also want to sell you. They want you to know they are experts, complete experts, and so yeah, you kind of get the point. So yeah, I also so back to what I was saying. So I start telling the doctors my experience. I tell them I give them context about the drug, that I show them that I know what I'm talking about. I tell them I don't tell them about Reddit and those forums. No, I just tell them that I have met many people online that have the same problem. I tell them that I know people from USA, from Germany, from Spain, from the UK, that and I tell them I have here their WhatsApps. I have met many people. I have met people in my own city, and I also tell them my hypothesis, what I think about this. And yeah, doctors realize I know a lot, and lately my experience have been, when I tell them that, they tell me, okay, so how can I help you? So they kind of, the dynamic change. They are no longer put themselves as experts now, and me as just another client. So when I show them that I know what I'm talking about, they kind of change to, okay, what can I do to help you? So some are still mean, rude, because they don't like that. They just want the quick money. But yeah, but I haven't had the experience where they don't really believe me, because it's simply, I mean, there's really no debate. There's really no debate. I mean, some doctors have just suggest me that maybe I don't have this condition. I mean, no, maybe this condition is not something real, that this is something called, I think, functional neurological disorder, something like that. And I look it up, and it's, I don't even remember what that is. But I mean, I have realized that all these topics, like, well, this type of topics like functional neurological disorder, or dysautonomia, or I think it's called, something, chronic fatigue syndrome, or long COVID, post SSRI syndrome, post SSRI syndrome. I mean, I have seen that these are very new topics. Science is very primitive in these areas. Probably in all autoimmune diseases and chronic diseases. So really, we don't really know what's going on. Maybe there's no permanent damage to my body. Maybe just something related to, it could be maybe something very simple related to serotonin. Maybe if I take another, again, the SSRI, maybe I get better. I mean, I tried doing that. Those who know my story, or who have seen my previous video. But yeah, I got worse doing that, so I don't recommend it. Who knows how much worse someone could get, because I still have sensibility. I don't know if you could die of this condition, because imagine if this is disabling your nerves. I mean, there's a similar condition, well, similar to a certain extent condition to this. There's a similar condition to this, well, similar to a certain extent. It's Guillain-Barré syndrome. I hope I pronounced that right. But like, I mean, it has something similar. It's not that similar like post SSRI syndrome or something like that. But like, it's, people die from that condition because I don't remember very well, and I could research it right now, but like, I really don't have motivation to do that. But if I remember correctly, the body kind of attacks itself, and nerves stop working, but to the point that organs fail, and that's why people with Guillain-Barré syndrome die. So I don't know if that could happen with post SSRI syndrome. I mean, I have heard people with complete loss of sensibility. especially like in genitals and stuff like that. I have also heard many people with eye problems and like urinary problems with this condition, post SSRI syndrome. I have also heard people with muscle weakness. I mean, I have muscle weakness, not that much. I can still lift weights and stuff like that, but it became a lot harder, and my muscles shake when I'm lifting weights. Like my muscles shake. They didn't used to do that. So like this post SSRI syndrome does have like physical effects, symptoms, but maybe it only affects the small nerves, so maybe it couldn't kill you. But yeah. Another topic is that I have tried dating with this condition. I mean, I have heard people that just stop completely dating. I still can do it. However, it's very confusing, I think, because I don't feel emotions as I used to. So I kind of my complete perspective of dating changed. Like it changed now to a very systematical way, and by that I mean that well, I see it just like a process, like a very like a very superficial process now. Like this, like it has to be like this, like this, like this, and I see indicators of it working, indicators of it not working. I have had a very hard time in having chemistry. Before this condition, I used to know when there wasn't chemistry, and when I used to know like very beforehand. I used to know when there wasn't interest of the girl, of the female. But now I kind of don't know. Like now it's confusing, and also like I don't feel much romantic emotions. I mean, the mechanism is still there. I still feel them, but it's like very numb, like reduced the emotion. Like, I mean, it's still there, but I can't feel it a lot. So I assume that's why I have a hard time understanding things. So my dating life has been until this point a lot of trial and error. I have done a lot of trial and error, and I'm still very confused in how it works. I have stopped almost completely going out with friends and hanging out with friends. Right before this happened, this nightmare started happening in January 2024. Right before this started happening, I used to meet my friends like every 2 weeks to play board games, and every week I will go out with friends to do things like hiking or going to a nightclub or doing many going camping and stuff like that. Now I just do it like once every 2 months. Like I completely lost interest. My life has been mainly trying to do productive things, like recreational things. Really, I barely do them. And maybe it's because of the numb emotions, I don't know. Also almost 2 years have passed, I kind of already forgot how things used to be. So sometimes I question myself, maybe this is age, maybe I'm getting older, maybe that's why I don't enjoy recreational things anymore. But who knows? Who knows? I mean, when I got a lot worse, just to remind all of you, I took again the SSRI and made myself a lot worse. Like when that happened, it happened like instantaneously. Like it was, I took the med and 30 minutes later I was feeling very weird, and since then to now I feel like that. So I don't think this is because I'm older, because I haven't seen change in my symptoms. I feel almost exactly the same. So yeah. Also, I'm sorry if I haven't had an order in this video, or if I haven't completed certain ideas I was trying to express. But yeah, I mean, it's hard to do it when I can't imagine. Also, English is not my first language. Also, I although this also happens in Spanish, I also have trouble speaking. So it's that's not really the main problem. Okay, so now to end this video, what are my plans for the future? What do I plan to do? Well, I have a group in Mexico. I made a website, kind of like a organization, but it's not formally established. I'm trying just to find other people with this, because I mean, if we're together we can do many things. It's easier to act, and people the rest of the people will put us attention if we act together and get together. So I'm working in that. I have tried contacting government institutions in my country. I'm still working in that. I have tried contacting media, and I'm still working in that. I'm looking to do more tests on myself. I recently got prescribed a new test, which is something about velocity of the nerves, something like that. I think it's put to the people with diabetes. I might do it, but I mean, I don't think there's it's too important, that test, but I might do it anyways. I might also get a MRI of the spine, just of curiosity. Also, I'm still having a hard time in making my insurance cover all of this. They haven't covered anything, but I think there really should be a way. It's just I need to do more research on how to get them to cover the past costs if they are still eligible, because almost 2 years have passed now for some studies. And yeah, I mean, I plan on continuing my life, my normal life. And by continuing my normal life, I mean not taking treatments, not yet. I'm also trying to get involved in some way in research. I think that's our best hope. And yeah, I plan to keep making videos, trying to spread awareness and trying to get this more known. and also I'm still learning how to make videos and how to do them with my symptoms. So sorry if this is a very shitty video. I'm sorry, and I hope you like it and it was useful in some way. And I also accept feedback, positive feedback and criticism also. I don't care. I don't care if there's hate also. I don't really care. It helps the algorithm, I guess. So thanks for watching.